Today's really important because what it does is bring together everybody who's involved in the health and wellbeing agenda across the whole of Buckinghamshire. So whether it's parish councils, district councils, the county council, the ambulance service, hospital trust, the clinical commissioning groups, GPs, and importantly also the voluntary and community sector. And we can look at how we can work much better together.
We've got a long history of working together across Buckinghamshire, and really what the accountable care system does is give us an opportunity to strengthen that and build upon it. It's a real credit to us in the way we've had this history of working that we have been honoured with being one of the 8 accountable care systems nominated as exemplar sites to take this forward.
I was really impressed that this is the first example that I've seen of the healthcare community and the social care community coming together and discussing this common problem in a public venue where we could all listen to what was happening.
The authorities, the councils, the organisations are looking to do things differently. I think they're aware that if they really want to work with patients and the public in partnership, they will be doing it in the terms that the patients and the public want.
In terms of the role that Healthwatch Bucks will play to support health and social care transformation, it's always going to come back to our core vision and purpose, which is about ensuring that the voice of the resident is heard in decisions being made about health and social care. What was great about the summit was to see so many different organisations, and I guess for me the question is around what role those voluntary organisations can play and how they get brought in to being part of a kind of stakeholder group that can be talked to on an ongoing basis. But I think also that where the voluntary sector is positioned at the moment is exactly where health and social care wants to be. It's embedded in the community, it's listening to those underrepresented groups, it's talking to them, it's being part of the local conversation.
I would say to Buckinghamshire, to close the health gap and improve the health of the people by how you work together. You know, good health is about a whole lot of things, a strong NHS, but even more importantly, about the importance of a strong economy and jobs that people, local people can get, and better housing, growth in housing, more choices, and creating a place where people want to live. So where there's a whole lot of things, reasons for, if you like, wanting to be in Buckinghamshire. And I know this is what your object is, and I can't convey sufficiently how supportive I am of what you're doing here.